We interrupt this program for breaking news from the Global National Newsroom.
Hello, thanks for joining us on TV and online. I'm Robin Gill. We're waiting for Prime Minister Justin Trudeau to address Canadians on the COVID-19 crisis. We'll be expecting him to talk about more measures to assist Canadians in need, including more mental health support. Before we speak to some of our correspondents, let's take a moment to look at the pandemic picture in Canada. Overall, there have been more than 57,000 cases of COVID-19 since the outbreak began. More than 3,600 people have died. Both of those numbers will likely rise today, and we should mention that those are the cases that have been tested. Moments ago, Ontario reported 434 new cases and 40 new deaths. But some good news in New Brunswick this weekend. Yesterday, that province reported no new cases of COVID-19 in the previous 14 days. The provincial government there says all of its 118 confirmed cases have recovered, making it the only province without an active case. And that is some positive news. But it's in stark contrast to Quebec, which confirmed more than 1,000 new cases yesterday and 114 new deaths. Let's go to our Mike Le Couture in Ottawa. Mike, the Prime Minister took a day off from his daily briefings yesterday. He's back again today, and the emphasis is on mental health. What can you tell us?
Yeah, he will talk about enhancing and creating new supports for Canadians to make sure that mental health is a priority for people. There has been a lot of talk in the medical community about this echo pandemic, and that was signaled weeks ago. And now, as we get deeper into this, as the lockdowns kind of continue, even though some of the restrictions will continue to ease over the coming months and weeks in different provinces, the Prime Minister really wants to address that. I think interesting, what's missing today and what continues to be missing is no help for seniors. We asked about it last week, continue to ask the Prime Minister about it. He says that's coming, but no specific program just yet. We know that they're on fixed incomes and it's more difficult for them. Also, he'll be speaking about the Canada Child Benefit, bolstering that. There will be a one-time upping of it for this month. So families that are entitled to receive the CCB for April 2020 will still have their eligible child for May. They'll see an extra $300 per child as part of the regular May 2020 payment. It's a one-time increase. And according to the government website, if you didn't file your 2018 taxes, you're not going to receive this payment. So he'll talk a little bit about that as well as we continue to go on in this. I know a lot of parents are having difficulty with childcare, and you're at home now, and whether or not schools are going back and you have to send your child like they are in Quebec. They're going to start on May 11th. That might be an issue. But back to the mental health issue, Robin. I mean, I think a lot of Canadians are starting to feel it. If they haven't already, it's nice here in Ottawa today, and people want to get out, and they can get out to a certain extent, but I think that still looms heavy over people. A bit of that dark cloud following people around, that you still can't go see friends, you still can't really open the doors and really get out to see people the way you want to, even though in different provinces they do have different measures where they are relaxing those. In some of the Atlantic provinces, if I'm not mistaken, it's in New Brunswick, where one family can open their bubble to another family and make sure that you see them. So I think addressing mental health is frankly long overdue, but the Prime Minister knows that it's important to do that at this stage, as we understand that while some provinces are relaxing some of their measures, it's still a long way off before we're going to get to a sense of normalcy. Not that normalcy that we all want to get back to, like, back in January, where we were free to go wherever we wanted to. The Prime Minister and health experts have clearly said that will not return until we have a vaccine, and that's still 12 to 18 months away.
Mike, we know that calls to crisis lines have gone up, especially in provinces like Alberta, where it's a case of oil prices going down, so people are unemployed in that industry. The calls are up, obviously, because they're confined to their homes. We know that domestic abuse is also going up. Anecdotally, we know this. So the Prime Minister is talking about mental health issues. Do you get any sense that there'll be some benefits for shelters? Because I know that they are brimming. There's a lot of people asking for space there, but there is that dilemma of, do you go into a shelter knowing that the space, even though they are putting in social distancing, what do you do?
Yeah, and that's one of the difficulties. We've heard from a number of people in a number of these shelters saying they're most concerned. As you mentioned, there are calls that are going up, but at the same time, shelters are hearing it being eerily quiet. And one of the issues is if your abuser is locked in the house with you or in lockdown in the house with you, there is no safe time to make that call. There is no safe space for you anymore as a victim. And that is one of the difficulties that a lot of people who are working in these shelters and running these shelters are concerned about, that abuse is going up and possibly it's unreported at this point because there is no safe time, there's no safe space for a victim to be able to make a call, be able to feel like they can get away. And that is obviously one of the biggest, most difficult things here. The Prime Minister has mentioned a number of programs that will help a number of different community groups, targeting a number of them, and difficult to see if whether or not this will be today, the day where they go specifically for shelters and that sort of a thing. But the fact that he's speaking about it, I think, is positive. And the fact that the government may move in a certain direction here is also necessary at this point.
Mike, let's switch gears now and talk about the various provinces that are easing restrictions. Quebec, New Brunswick. You reported on that yesterday. Obviously, lots of controversy when it comes to Quebec, especially with all these new cases.
Yeah, exactly. And when you see the cases continue to go up and why they continue to go up, and where the spread is and how officials there are trying to explain why they need to get back to school, why schools need to reopen, even though it's optional. So May 11th, elementary schools will reopen. It's optional, and it's unclear at this point whether or not there will be, all the protections in place. Interesting tidbit, not to show too much of my personal life, but my brother's a teacher. He's an elementary school teacher, and I've spoken with him a number of occasions. We're exchanging texts all the time, and he's concerned. He isn't sure yet. He hasn't heard yet from the government or his union as to how he will be protected. Will he be given a mask? How does he ensure in an elementary school that there is enough physical distancing? Anybody who knows, we were all elementary school students at one point. Keeping apart from our neighbor in the classroom is not exactly an easy thing. So teachers are looking for those reassurances, especially in Quebec, especially when you consider what the numbers are looking at. And teachers will tell you, maybe the symptoms are not showing very much in students. Maybe students aren't really getting COVID-19. But what about them? What if the student is asymptomatic, passes it to the teacher? And a number of these teachers are, north of 40 years old. So they are in that zone as well where it is an issue. So when you look at all of the different provinces, I think we also talk about Ontario and Doug Ford as being extremely conservative in opening things. Just on Monday, we're going to have nurseries and garden centers open for curbside pickup, a little acknowledgement of the weather and making sure that people can get out there and plant their gardens and try and return to that sense of normalcy. Also give them a sense of, give them something to do, frankly, if they're at home and they feel like they want to do something like that. But different provinces going at different speeds. And, the Prime Minister acknowledged that, a week or two ago, saying, look, different provinces are in different places, different postures. So we'll allow them to go at their own paces and making sure that they continue to follow those federal guidelines that everybody's agreed to on those calls with all the premiers and territorial leaders, that will all sort of go with the checks and balances, making sure that there's enough testing, making sure that there's enough hospital capacity. Jason Kenney, the Premier of Alberta on the West Block, in an interview with Mercedes Stephenson, said, look, our idea here, and the reason we did all of these health restrictions and limiting where people were going and how many people were going outside, was to maintain the ability to let hospitals catch up with the possible rate of infection. So, the flattening the curve was not about lack of transmission, but it's also to make sure that hospitals were stocked up and were staffed up to be able to deal with this. And it seems like everybody feels, or all the provinces that are moving forward, feel like they're at that stage now.
Okay, Mike, we're going to get back to you after the Prime Minister speaks. Let's turn now to Keith Baldry. He's the Legislative Bureau Chief for Global BC. Keith, in the next few days, the BC government will show new modelling on the pandemic in that province, and Premier John Horgan is laying out his plan to restart business in that province. What are you hearing on these fronts?
Well, it's important to point out, Robin, as you know, BC really hasn't had a lockdown like many other provinces have, notably Ontario and Quebec. The only things closed here by public health order are casinos and personal health services, personal services such as hair salons, nail salons, tattoo parlors. Schools are closed, but schools are open, but classes are canceled. Schools are actually open right now, and children of frontline health workers are actually in schools right now, receiving in-class instruction. So our model right now, our situation is, I think, a little different than other provinces. So when we reopen this week, we're not actually reopening a lot of things that have been closed by edict. It's more the self-imposed shutdown that have occurred in so many businesses in British Columbia. Retail shops have closed on their own, not through order of the public health officer. There'll probably be some easing of restrictions on restaurants, which are shuttered right now, except they can have takeout and delivery services. They haven't been. They've only been closed for at-table dining. So we're going to see some relief sketched out by the Premier and BC's Provincial Health Officer, Dr. Bonnie Henry, at midweek this week. So it's going to be interesting to see whether businesses are going to be up to the challenge already sketched out by Dr. Henry yesterday in her briefing. Sort of visualizing what provinces can do. Get your heads around the fact you're going to have some physical barriers in your businesses. Invest in some plexiglass windows, for example. Have 6-foot intervals between your customers and other customers and your staff. Perhaps allowing your staff or giving your staff some access to non-medical masks. So it's going to be an interesting take from the province out here midweek. And whether businesses respond to what Premier Horgan has to say is going to be the challenge. The Premier talked last week about the need to reinstill consumer confidence. That's what's really shutting the BC economy down. I think the economy across the country, where there's not lockdown provisions in place, is consumer confidence. You've got to be confident, go out there and shop, to be actually safe in the business you want to attend, but also confident that you want to spend money because you're secure in your own economic situation. It's a dicey proposition, Robin. I'm not sure everyone's up to it, but it's going to be a long and slow, gradual reawakening of the economy, both in British Columbia and the rest of the country.
Keith, yesterday, the Barbers and Hairdressers Association, or whatever their industry is, presented a petition to the provincial government asking to reopen, but Dr. Bonnie said, not going to happen. Whatever will you do?
Yeah, I know. This little mop up here is going to get a lot longer and I'll have to say right up front, it's going to get a lot curlier too. If my history is any indication, it's going to get long and curly. So Dr. Bonnie Henry is making it clear. Hair salons will not open in British Columbia anytime soon because they cannot right now establish that social distancing, that 6 feet that is required between two individuals in terms of avoiding personal contact. So at some point they will reopen. I think once we get involved with masks and gowns and gloves and plexiglass, then I think industries are going to be able to adapt. But it's incumbent upon industries, both in British Columbia and I think a number of other provinces as well, to show that they can meet the test here. They can meet the requirement to keep your physical distance and still operate. And that means protecting your staff and protecting your customers. And that's a challenge a lot of businesses are facing now. They've got to literally figure out how to conduct business, but keep those physical barriers between people. And some businesses will thrive. Other businesses is going to be an enormous challenge. Hair salons, unfortunately right now, I don't think have figured out a way to do this. But at some point, as the numbers ease on a daily basis in terms of new COVID-19 cases, I think those restrictions will ease and through the summer. When we get into the fall, it might be a different situation as that second wave may hit us. But I think right now, short term, no hair salons in British Columbia are going to be open, and that's bad news for my hair.
It is indeed. We have to remind you when to get a haircut, even though we are in Vancouver and you are in Victoria. As the weather gets warmer, on the West Coast, you see a lot of boating action. What are the rules going to be about getting on your boat and getting on the water? Do you have to have some social distancing within your own boat?
Well, so Dr. Bonnie Henry is expected this week to address the bubble. And you heard Mike talk about the bubble. We're all living in a bubble right now. Our bubble right now consists of our members of our household. maybe some of your work colleagues. But that bubble will now be expanded, but it's not going to be expanded greatly. But you are going to be advised that you can spend more time with more people than just your household members. And presumably that is going to apply to things like boating and recreation. BC Premier John Horgan and other premiers have talked about the need to get out there and enjoy the summer, enjoy the outdoors, enjoy recreational activities. So there's going to be, I think, some advice given by provincial health officers and premiers to how you can do that, but still keep your social distance from each other. You and Mike talked about mental health. That's a big part of public health right now. We've talked to Dr. Bonnie Henry here. Adrian Dix, the BC Health Minister, has talked about this. Mental health, and by that I'm talking about depression and anxiety, is a mounting concern as we go through this pandemic. You have to allow people literally the ability to breathe and to get some positive activities out there to get out from just, you know, sheltering in place and being in your bubble. So things like boating, going into parks probably will be revisited as well. The parks right now in BC are closed. That is being revisited in the weeks ahead. So we're going to start opening up those recreational activities, but still keeping in mind you've got to have contact with relatively few number of people. And when you do have contact,
we're going to interrupt you now because the Prime Minister has arrived. Let's listen in.
I want to start by recognizing that today marks the 75th anniversary of the Battle of the Atlantic. As we remember the sailors, soldiers, and pilots who helped turn the tide of the Second World War, we honor all our veterans who stepped forward so we may live in peace. We think of the brave men and women who serve today, and we mourn the 6 heroes we lost just last week. To their loved ones, to those serving on HMCS Fredericton, and to all CAF members, I want to once again offer my deepest condolences to Canadians. Over the last 4 months, Canada has faced challenge and heartbreak on a scale we could never have expected. So if you're feeling overwhelmed, that's understandable. If you need support, that's okay. In April, we launched Wellness Together Canada, a website where you can find people to talk to if you're in crisis. And today, we're taking another step forward. Our government is investing over $240 million to bring healthcare online. We're expanding existing online tools, creating new virtual platforms for mental health and for primary care. Let me start with a new platform for mental health. Whether you're looking for strategies to manage stress or support from a professional, this will be a resource for you. And if you're part of a marginalized community and you need specialized tools, well, there'll be specific help for you as well. If we can provide mental health support online, there's no reason we can't leverage technology in other areas of healthcare too. This $240 million investment will also include funding for virtual care for times when you don't need to see a doctor in person. Just take video conferencing. By helping doctors run appointments online, you can stay safe at home while getting care, and our hospitals can stay focused on those who need it most. If we can use apps to order dinner and video chats to stay in touch with family, we can use new technology to keep each other healthy. Aujourd'hui, on annonce un investissement de 240 millions de dollars.
Of $240 million in online healthcare. This investment will allow us to widen access to services and offer more resources to Canadians. These funds will serve in particular to create an online platform that will offer a multitude of mental health care services. It will also allow us to offer a wider range of virtual care when it is not necessary to see a doctor in person. By offering this online care, we can reach more people and reduce the pressure on our healthcare system. And since we're all practicing physical distancing these days, it is exactly the right time to invest in such solutions.
We have to think outside the box. When Canadian researchers have a solid lead, we need to make sure they can follow it up. That's exactly what we've been doing over the last 2 months, and we're starting to see real results. Today, I can announce that we're investing over $175 million to support the Canadian company AbCellera for their very promising COVID-19 research. They've identified antibodies that could be used in drugs to treat this virus. This new funding will help them continue their vital work and will support human tries beginning as early as July. But until we have effective treatments, or better yet, a vaccine, we still need a reliable supply of everything from masks to ventilators. So later today, Minister Anand will announce the details of a new COVID-19 Supply Council. This council will be tasked with finding innovative solutions to ensure our country continues to have the vital supplies necessary to keep Canadians safe.
We'll be investing more than $175 million to support the research efforts that are very promising at Abcelera. This company is currently attempting to identify antibodies that could be used to make drugs to treat the virus. Our investments will allow this business to continue its research and will also support clinical trials to start in July. Later today, Minister Anand will give more details on the new COVID-19 Supply Council. This council's mandate will be to find innovative solutions to ensure that we always have the equipment that we need, such as masks and hand sanitizer.
I want to end today, as I do most Sundays, talking to families, to parents. I know this is a tough time right now to be raising kids. Right now, you should be able to focus on keeping your family safe, not about worrying about the bills. So this May, you'll get more help through the Canada Child Benefit. When you receive this month's payment, you'll see an extra $300 per child. For families with 2 kids, that means an extra $600. For 3 kids, an extra $900, and so on. This is money for whatever you need, whether it's online tutoring or groceries. And to all the kids out there, I know things are hard for you too. I know you miss your friends, and it's not always easy to do your schoolwork online. But this isn't going to last forever. So keep planning fun things to do with your friends once this is over. Keep up on your homework. And remember, we're going to get through this together. So thanks for all your help around the house, with your parents, and on sticking together through this difficult time. Si vous êtes un parent, on met plus d'argent dans vos poches.
If you're a parent, we're investing more money in your pockets this month. You'll see that in your child benefit payment, which we will be receiving in a few weeks, you will be receiving $300 more for each child. So $600 more for 2 children, $900 more if you have 3 children, etc. In order to support you in your diverse needs, whether it be for groceries or for online tutoring for the children. It's tough for families these days, so we're giving a little helping hand to parents to help them out. I know that it's also hard for children. You're missing your friends. You'd like to be outside, go play in the park, and I know you'll be happy when all of this is over. But the good news is that we've already come quite a long ways these last few weeks, and we have to continue. I know it can be tough, but it's really important that you also contribute in the house, help your parents, and that you keep a positive attitude, because we'll get through it if everybody continues to do their share, and we'll do it together. Thank you.
Monsieur le Premier Ministre, on va commencer la période de questions par le téléphone.
We'll start the question period with a phone call. Operator? Lena Dube, Canadian Press. Good morning, Mr. Trudeau. I'd like to know more about this $240 million amount you're investing in healthcare. Does this mean that you'll be transferring it to provinces? We also heard someone earlier this morning talking about irrefutable proof that it comes from a laboratory in Wuhan. I'd like to know what you think about that. Answer. The money is for online mental health services that will be offered at various levels, and yes, some of it will be for provinces. Now, about how and when the virus started. I know it might be interesting to know that, but our real concern here is to know what we have to do now to help people. These other questions will remain, and we'll try and find answers to them. But our priority is and remains for the weeks to come what we can do to protect Canadians now. So, does that mean that you haven't read about this proof that some Americans are talking about? An answer. There's several theories being bandied about, several hypotheses about how it could have happened. But while the pandemic is on, I'm concerned about how we manage the situation. Later, we can ask the other questions and find out how it all happened.
While this is happening, our focus needs to be on what is happening and how we help it. There will be much time in the coming weeks and months for reflecting on how it happened and how we can prevent it in the future. But for now, my focus is on how we make sure Canadians get all the help they can right now.
Thank you. Operator, next question.
Thank you. Merci. Next question, Lee Berthiaume, the Canadian Press. Line open.
Yes, thank you, Prime Minister. I just wanted you, if we could speak to a different topic for a second. Premier Doug Ford yesterday took aim at your measures around the assault rifle ban, suggesting that the money for buybacks would be better spent on border security and cracking down on smuggling. Could you respond to his comments, please?
We know that there is more to do on strengthening gun control in this country, which is why we're going to be moving forward when Parliament allows it with stronger measures around borders, stronger measures around safe storage, measures around handguns to permit municipalities to ban handguns within their city limits. We know there is more to do, but we also know there is no place in Canada for guns specifically designed to kill the largest number of people in the shortest amount of time. That is why we are moving forward with a ban on military-style assault weapons. Okay.
We do recognize that there's much more to do to reinforce the control over firearms, and that is why that we will table a bill when Parliament allows it, in order to strengthen our border control and implement other measures, in particular on handguns, and continue our buyback program for military-style assault weapons. Simultaneously, I'd like to point out that there is just no place for weapons invented for the sole purpose of killing the most number of people in the least amount of time. Such military-style assault weapons have no place in Canada, and that is why we have banned them.
Tomorrow we're going to see a number of provinces, Quebec and Ontario in particular, start reopening their economies. Do you have any thoughts on the measures that have been announced by some of these provinces, especially Quebec, given that we've seen ongoing increases in the number of COVID-19 cases?
We all, provinces, territories, and the federal government, agreed on shared principles that we believe in terms of opening gradually, opening carefully, and remaining extremely vigilant as different regions take different measures to restart the economy while keeping people safe. Our focus every step of the way is going to be to support Canadians across the country as we move through these next steps. Different regions will have different measures to bring in at different times, and our job is to make sure we're supporting them as best we can as we go through this carefully and step by step. Okay. Les différentes provinces vont agir.
The various provinces will act differently, but we had all agreed on some basic principles about the necessary elements for a gradual reopening and a careful reopening. Our role as the federal government is to be there to support provinces in the decisions they will make to help all Canadians throughout the country as various regions start implementing measures according to their perspective about what is appropriate for them right now. Next question, operator. Joël Denis Bellavance, La Presse. Good morning, Mr. Trudeau. My question is about the coming into effect of the new CUSMA. There are some people who thought they've been tricked by saying that it would be implemented on the 1st of August. So is it the 1st of August or the 1st of July? Well, we always was very clear with milk producers in particular and all Canadians to the effect that we would attempt to have it come into effect as soon as possible, but that we didn't think that we could convince the Americans to wait for that date of the 1st of August. And in this case, we see that it will come into effect on the 1st of July. And as I said, there will be compensation for milk producers. It's a good agreement for all Canadians, but we do understand that it will require compensation for our milk producers. Follow up, Mr. Bellavance, yes? If the Hockey League starts playing again, what are we going to do with the European players that aren't permanent residents? Will they be able to go back and forth over their borders, even if the hockey is a non-essential service? Answer, that's a question we'll have to have a look at. At least, anybody who arrives here from another country will have to follow all quarantine rules, very strictly, in fact, but we haven't reached that point in our discussions with the National Hockey League yet. We do recognize that reopening is a possibility, but it depends on many things, and I don't want to put forward any tentative hypothesis until we have discussed the matter for the operator. Next question.
Good morning, Prime Minister. I want to follow up on Nita's question about this intelligence assessment. The Fox News is reporting that American intelligence is saying there's now a growing consensus amongst major intelligence partners that COVID-19 was actually leaked from the Wuhan government lab. Is that not your position? I mean, if the American government is saying there's a consensus, is it not sort of incumbent on you to clarify Canada's position, given we are a member of the Five Eyes Intelligence Partnership?
We have been cooperating and working with our Five Eyes partners from the very beginning on various intelligence that has come out on this and other subjects. We will continue to work with intelligence agencies around the world, not just the Five Eyes, but friends and partners as well, and look to find answers to the many questions people are asking. But it is still too early to draw firm conclusions, and indeed, our focus remains on how we are working to protect Canadians, how we are ensuring that Canadians have our entire focus right now and our entire ability to support them through this time.
Follow-up?
So when you say that it's too early to draw firm conclusions, is it fair to infer from that Canada has not come to the conclusion that this was sourced from a Chinese lab? And is there any sort of investigation being ordered either by CSIS or CSE to investigate those claims?
We continue to work very closely with our partners and allies, and indeed independently, on many security issues that are important for Canadians. At this point, we are not drawing any firm conclusions.
Marika Walsh with the Globe and Mail. Prime Minister, can you tell us more about the Supply Council? What specifically will it be focusing on, and how long is its mandate?
From the very beginning, we've made it an absolute priority to procure the necessary personal protective equipment for our frontline workers in this country. We have managed to work with the provinces on sourcing necessary products from around the world so that we've been able to meet the demand across the country. At the same time, we recognize that it was important to develop our own domestic capacity for PPE, and that is coming online now. At the same time, we recognize that as the economy starts to open in different places in different ways, it is going to be important to have even more personal protective equipment for people working in the private sector in various industries, and that's why we need to do everything we can to ensure we're getting the right procurement. That's why we're moving forward with this Supply Council, and Minister Anand will be at the noon press conference to answer more questions on the Council.
And on the reopening and how PPE interplays with that, should Canadians expect to be required to wear masks more frequently as this reopens? We've already seen on airplanes that masks are now required. Where else will we see that happen?
I think what specific rules will be in place will depend on the jurisdiction and the region in which people find themselves. We see very different realities right across the country. But certainly social distancing rules will continue to apply, and using masks in situations where it's more difficult to use full social distancing is going to be very important as well. And I'm certain we will be seeing more people using masks. Okay.
The various rules that we have in the country will be implemented by local authorities, but it is pretty sure that as we move forward and to continue practicing social distancing in situations where it's difficult to separate physically, then we'll be seeing more and more masks being used, like in planes.
Will your government be putting forth any sort of fiscal update this month in terms of new government spending related to COVID-19, and would that include plans to start reducing the deficit?
We're going to continue to stay transparent on the investments we're making to help Canadians through this. We knew from the very beginning that one of the best ways to keep people safe and healthy was to give them the capacity to socially distance, to stay home, to isolate. And that meant sending income supports through the Canada Emergency Response Benefit, through the wage subsidy, through loans for small businesses, through many other measures of support for different groups. We know that the best way to stay healthy is to support Canadians while we go through this difficult time. We have been open and transparent about that every step of the way, and we're going to continue to be open and transparent with Canadians about the investments we're making to keep us safe and the investments we'll be making to get our economy going. Our economy was strong before we went into this, and we have tremendous confidence in Canadians' ability to come roaring back as we reopen in a gradual way. And that's why we are confident about the future of the Canadian economy, and we will have, of course, more updates and more to say about that as time moves on.
And with regards to gun control, the grandfather clause of these measures seem to allow owners of these guns to apply to keep them in some sort of fashion. And I'm wondering, is it really a ban if some people can still keep those guns?
We know that banning military-style assault weapons was an important step in keeping Canadians safe. That is something that we have done because guns designed to kill the largest amount of people in the smallest amount of time have no place in Canada. We've brought in a 2-year amnesty so that people who've purchased those guns legally will have time to be able to comply with the regulations the regulations we've brought in, and the buyback program and legislation that we're going to move forward with at the first opportunity when the House turns its attention to things other than COVID. That means that we are going to keep moving forward on reducing the number of assault weapons in this country. The details on the buyback program, the details on the rules as to what happens at the end of this amnesty period will be worked out in legislation with other parties, with the stakeholders across the country. We're going to take this very, very seriously because we, as Canadians know, are deeply committed to keeping people safe and strengthening gun control in this country.
Prime Minister Rachel Haynes from CTV National News. Following up on the gun question, the day that you announced the gun ban during your election campaign, you first toured around the Danforth where a shooting had happened by a handgun. We know that almost 60% of all firearm-related deaths in Canada use a handgun. You keep saying that there's no place for military-style weapons in Canada, but why is there still a place for handguns in Canada? And what evidence is there that shows that banning the guns that you chose will actually curb gun violence here?
We've seen far too many mass shootings in which military-style assault weapons were used to kill innocent Canadians in Sainte-Foy. recently in Nova Scotia, back at École Polytechnique 30 years ago. We've seen far too many cases in which these guns have caused devastation to families and communities, and that's why it was time to ban them. This is something that we were able to do through regulation, so it didn't require legislation, but new measures that we intend to bring in on allowing cities the ability to restrict handgun use and handgun ownership are going to be brought in as we work on legislation, as the House turns itself to measures other than COVID-19, and we know there is going to be broad support across political parties to do just that. Okay. Nous avons pris des mesures concrètes.
We took concrete steps right now to limit access to military-style assault weapons because there have been too many killings and innocent lives lost to these firearms these last 30 years in Canada. It was high time that we act on this. However, there is more to do, and that is why giving cities the capability of banishing handguns in the months or years to come will be an important measure, and we will be working on a bill with the parties who agree with us on this matter and all other groups who want to see greater firearm control in our country.
I'm hoping you can tell us about the Spartan Cube test setback. There are provinces, including Quebec, that have purchased these. They're set to reopen starting tomorrow. What concerns do you have, or what does this mean moving forward if there are provinces that are relying on this to ramp up their testing to reopen?
We have said from the very beginning that in this unprecedented crisis, we needed to move very, very quickly. We moved quickly on economic measures, but we've also accelerated the testing, the approval, the processes by which we can get potentially life-saving measures out there to Canadians. But when we do that quickly, there are going to be new facts that come in and situations that evolve that will require shifts in our postures. That is why we are being as nimble as we possibly can to respond to what's working, to what perhaps isn't working as well as we had hoped it would, and we will always need to adjust every step of the way as new information comes in on a daily basis through this pandemic, through this crisis. Similarly, provinces will have to adjust to new realities and adjust to successes and challenges as they come up. We know that one of the things that Canadians expect us to do is react quickly as new information comes in and new understanding gets gleaned, and that's exactly what we'll do. On a su dès le début qu'il fallait qu'on agisse.
From the outset, we knew that we had to act quickly in this crisis emergency to ensure that we did everything we could to protect Canadians, and that is exactly what we did by investing money, seeking new ways to save lives. But when we act quickly, we also quickly learn that there can be different levels of success or challenge associated to some of the processes or equipment. And so we're reacting and answering to the evolving situation. Canadians expect this from us. And in provinces, people will have to have a look at any new information and decide whether it changes their approach. I think Canadians do not expect that everything we say will be perfect for months to come. They expect us to adjust as necessary, which is exactly what we do. Vincent Foisy, CBC Radio-Canada, concrete question for you. Do we have enough testing equipment, particularly having learned about Spartan, to reopen, for example, in Saskatchewan or Quebec? Answer. These are decisions that provincial and territorial governments will have to answer for themselves. Our responsibility at the federal level is to be there to support provinces, to help them find solutions to do wider testing, providing the reagents and other equipment necessary to ensure the level of testing that they have decided as being necessary. Our job is to support provinces in their decisions, and it's up to the provinces themselves to have a look at any new information that comes out that tells them whether they can go faster or slower. It's up to them to make those decisions, and our job is to support them in their decisions.
One of the things we need to understand is it is to the provinces to determine what is the right step for them, given the tools they have, given the profile of the disease that they're facing. Our job as a federal government is to be there to help provide them with the equipment they need, the support they need as they make the right determination in their region, in their territory, in their province. We know that there are very different situations right across the country, and the federal government needs to be there to support the provinces in the different approaches and strategies that they take.
Donc, vous dites pas clairement, oui, on a assez de tests pour
So that's not a clear, yes, we have enough tests to open the economy. So do you understand that some people might be somewhat worried, and they might ask themselves that if there's a second wave in the weeks to come as we reopen, can the federal government take over and say, enough is enough, we're going to close down again? Is that something that you can actually do? Answer, my responsibility is to work with provinces so that they tell us, we need this, this level of testing, etc. Can you help us reach that level? And so that is our job, our responsibility, to help provinces reach those level of testing that they decide on. We answer to the realities and requests that provinces see on the ground. Our job is to be there and help coordinate throughout the country, but to respect the decisions that the provinces make facing the crisis. If ever a province starts opening up and realizes that unfortunately there's a fast increase in the number of cases, it'll be up to the province to react. And I know that the citizens of every province will point out that they want to see things change if that happens. So, but we'll be there to help out and support the good decisions for Canadians.
That as provinces move forward, it is possible that we will see a rise in cases in different areas, and the provinces will have to respond with measures either specific to that area or broader measures. And every step of the way, the federal government will be there to support and be part of the solution as we keep Canadians safe. But I can certainly tell you that after having spent weeks in isolation, many Canadians will be very, very alert to any signs that we might be entering a second wave, and will be demanding that their leaders respond to keep them safe. Merci beaucoup tout le monde.
Merci, c'est ce qui m'a fait la conférence de presse aujourd'hui.
Thank you very much.
And that was Prime Minister Justin Trudeau speaking outside Rideau Cottage, taking questions about the government response to the COVID-19 crisis. Let's go back to Mike Lecouture in Ottawa. Mike, he made a few announcements today. First of all, let's talk about his investment in mental health.
Yeah, and making sure that he does address this and some of these online tools that they'd already launched in April, and sort of continuing on that, and also opening up other medical treatments online, not treatments, but rather resources, saying, look, if you can order food or different things online, well, then why not use teleconferencing and video conferencing for health as well, making sure that people understand that if you do need help, that you can go to some of these resources, to some of these websites, really trying to underline that and continuing, these are smaller announcements, but also talking about that, that special supply group that will now be tasked with making sure that there's more personal protective equipment for frontline workers, and making sure that we ramp up the manufacturing and the purchasing of that. The Prime Minister noting that as different provinces start to open up and start relaxing some of the restrictions, that we may need more of these, more masks, as the potential is that different provinces mandate, or different regions mandate, that you will have to wear a mask in public if you are going to be out in public. So that was kind of the snapshot of what we saw today with the announcement. And, again, on a Sunday, he, addressed kids and trying to say to them, look, we know that this is difficult, but it's interesting that he said, continue to plan those play dates and those things, those different things with your friends. We're going to get there soon. We'll get there eventually. Trying once again to provide that sort of light at the end of the tunnel, that we will get there, that eventually we will get out of this to a certain extent, and trying to, again, on a Sunday, provide a bit of sunshine to all of the, the announcements of, look, we're still in this kind of lockdown mode, even though different provinces are opening at those different speeds.
Mike, he's also talking about investment in Canadian research, which is probably a positive in this pandemic. Is the investment that is going towards research specifically for drugs to treat, vaccines to prevent, and obviously expediting clinical trials? Tell us about that.
Yeah, and making sure that, there is a focus on this in certain companies and targeting them. There's another company that he was asked about with the Spartan Cube, this testing thing. Then there's been a story out that they're having issues with that, and the Prime Minister acknowledges that, look, as we push forward, as everybody tries to push forward on finding some of these, not to say a cure, but at least treatments, that there will be setbacks, that there will be different issues that they encounter, but trying as much as possible to put federal tax dollars towards some of the more promising ones out there, and making sure that there is the full weight of the federal government behind them if they feel that they have some sort of optimism in a cure or even the drugs to treat it. So it's interesting to see how the government is trying to push in that way, and as you said, sort of expediting some of the processes, while at the same time making sure that there are no terrible side effects to some of these things, and ensuring that if there will be a vaccine that comes out of Canada, that it is the vaccine before it goes forward, because the last thing that I think this government wants to do is to put their weight and put their support behind something that possibly doesn't make it all the way there, or possibly isn't as good as what it should be, because once one country or one industry finds this vaccine, there will be demand on it from the globe, from the entire globe, and there will have to be capacity to make that as quickly as possible and as much as possible, because it is needed across the world.
There is a real race on for this right around the world. Let's talk about the Canada Child Benefit. Mm-hmm. How does that break down?
Yeah, so extra money for that, or announcing that, May will be a bonus, so to speak, a little extra, $300 extra, up to $300 extra per child. That's not taxable, so that is, a good help for parents as well. And the Prime Minister sort of acknowledging that it can be difficult, as extra difficult for parents who are out of work at this point in time and trying to make ends meet as they go ahead. They may have the CERB that they're leaning on, or the wage subsidy that the government also announced. But trying to make sure that they continue to support families here, and it's just for this month. I would think that the government may look towards June as a possible extra benefit, or another month down the road. If they've already got May, they may be looking at this saying that we're going to need this for a little longer, and possibly look at this another time.
All right, Mike, we're going to stay with you, but we want to bring in Keith Baldry for some analysis. One of the questions that the Prime Minister was asked is, do we need a fiscal update? He's sure making a lot of announcements and handing out a lot of money.
Yeah, it's an incredible amount of money. The deficit now in excess of $250 billion. I mean, this is mind-boggling stuff. If you go back to the last election campaign, there was arguments whether the deficit was going to be 25 billion or 30 billion. Now we're at $250 billion and counting today. Relatively minor spending announcements, $175 million for research, $200 million as well on top of that for other measures. So at some point there has to be a fiscal accounting here, but I don't think really the public is clamoring for that anytime soon. Right now I think the public is still in the mode of, look, we need help. We need money now. We'll ask questions later, but there has to be a fiscal reckoning at some point. And the word deficit right now is kind of meaningless given what's taking place, Robin, I think. In the past, we used to argue about balancing the books and the need to keep the deficit low. Right now, that is simply not part of the debate. Right now, the debate is how can I get money fast, because we have so many people unemployed, so many people in a fiscal emergency crisis mode right now. They're looking for governments literally as a handout. We right now have the creation of a guaranteed annual income, which for years was always debated, never seen as something that was likely to occur. That is actually now occurring, at least on a 3 3-month basis. And again, in terms of balancing the books, those days are gone. So I think there's going to be a fiscal accounting for this, reckoning. But I don't think it's necessarily what the public wants to see right now. They want to see checks in the hand.
Does it sound like a campaign, though, an election platform? This is a minority government.
It is a minority government, but it's acting like a majority government. We're seeing that in other jurisdictions. Right now, it's very hard to be an opposition party right now because the traditional parameters of political debate have disappeared as we're in this crisis, and we're going to be in this crisis for some time. I'd be very surprised. It's hard to see politicians going into sort of classic political campaign mode at a time when people aren't interested in politics so much as they're interested in relief. So they are a minority government, but the only party that seems to be acting like a political party in Ottawa right now is the federal Conservatives, who are acting like trying to act like a traditional opposition party does. The federal NDP and the Bloc right now are basically partners of the federal Liberals. And we're seeing that in other jurisdictions as well, where the opposition parties are standing back, letting the government do what needs to be done because we're in such a crisis. So fitting an election campaign into something like that could be a tremendous backfiring for anyone who goes into that.
Mike, I want to bring you in on this thought that Keith has brought up about the Conservatives acting like a traditional opposition party.
Yeah, and they continue to ask for those in-person House of Commons sessions to hold the government to account. They're calling them accountability sessions. And I think that they may, to Keith's point, find a bit of a backlash among the electorate when they continue to bring up the deficit. Now, this is obviously bread and butter for the Conservatives. Nobody can fault them for that because this is what they want to do and need to do. But at the same time, to Keith's point, I don't know one Canadian out there that I've spoken to or that we've gotten emails from, as we all do, that say, what about that deficit? What about that debt? I mean, the question about that, you look at it and you say, well, every country is going to have to grapple with this at some point. Every country is rushing aid out the door and sending money to their citizens and realizing that they are spending more money than they actually have. So yes, it's going to be debt that Canada has to pay back, but it's debt that the world has to pay back. So to keep hammering on that, I think sometimes maybe a little tone deaf on some of the opposition parties if they continue to try and keep that going. And as Keith said, it does seem like by and large there is a Team Canada effort here. And, you know, we have seen a bit of this with the Conservatives being allowed to, and rightly so, taking a bit of a victory lap on the wage subsidy bill that they said, you know, was originally at 10%. We suggested it go up to 75% of people's wages, and the Liberals not really standing in the way of that and, you know, admitting that they're working with other opposition parties to make sure that any benefit is beneficial to Canadians and the most beneficial to Canadians. And I really think at this point, even though we're now starting to see, because the Conservative leadership campaign is ramping up again, so we're going to start to see some more of that political rhetoric and the questioning of what's going on and what is happening. And I think at the same time, you have Andrew Scheer, who is standing in position as the interim leader, who feels like he still has to do some of that work and still wants to be seen as somebody who is the leader and not a lame duck leader. But you'll have a lot of these candidates who are coming up and talking about whether or not we need more accountability and what we need to do in questioning the government here and there. You know, Jagmeet Singh is doing the same. The NDP leader is talking about how there needed to be more programs for students and how even the student program wasn't enough. The CERB, in his mind, needs to be opened up to everybody. But there is a bit of a collaboration that we're seeing here, and I think it's responding to what Canadians want, which is talk to me about how I can be helped today, not the political issues that we're going to see and that we always see on the Hill that nobody likes to see, all of that politicking.
All right, thank you for your thoughts. One last question to you, Keith, is the question of reopening right across the country. The Prime Minister is always asked about that, but he always says it's provincial jurisdiction. Once again, he talked about that with Quebec.
Yes, it is provincial jurisdiction, and there is a bit of an ongoing tension between the federal government and the provincial governments of who's in control here. There's been tension in BC, for example. BC was one of the first provinces to call for closing down the border, and Ottawa was slow to take that measure. So it's going to be interesting in the days ahead. Keep an eye on the cases on 2-week intervals. There's a 14-day incubation for this virus, and it'll be interesting to see provinces revisit the reopening measures if those cases spike in the weeks ahead.
All right. Thank you so much, gentlemen. It's always a pleasure to talk to you both. Let's recap what Prime Minister Justin Trudeau said in his daily address to Canadians. Ottawa will spend $240 million to bring healthcare services online, including support for mental health. There's also a big investment in research, $175 million to support the research of Canadian company Abcelera. The Prime Minister says a new COVID-19 supply council will be formed to ensure Canada has enough medical and protective equipment that is so necessary to prevent the spread of COVID-19. And some more money for families through the Canada Child Benefit, an additional $300 per child on the check coming this month. And you'll find full details on globalnews.ca and tonight on Global National. And be sure to tune into Global TV tonight at 7 p.m. for our special series, Coronavirus, The New Reality, hosted by Donna Friesen. I'm Robin Gill. Thank you for watching. We now return you to regularly scheduled programming.
This has been a special report from Global News.
Okay, good afternoon, everyone. So we're going to start by hearing from Dr. Tam and Dr. New, and then we're going to hear from Minister Anand and Minister Baines by video conference. Doctor?
Good afternoon, everyone. Bonjour à toutes et à tous.
Good afternoon, everyone.
Numbers on COVID-19 in Canada. There are now 57,148 confirmed cases, including 3,606 deaths. To date, labs across Canada have tested over 893,000 people for COVID-19, with about 6.5% of these testing positive. Here is the part where we usually move on to a brief update on how we are continuing to slow down the epidemic, and what's needed next was to get down the curve cautiously together. Instead, I want to pause here to reflect on the significance behind our daily numbers that are impossible to fully encapsulate. Each one of the over 57,000 cases has been an illness, striking fear and concern in a person and their family, friends, and community. Each death has been an incalculable tragedy, and to this, that each death has most often meant a goodbye being said with loved ones who are not able to be physically near or to give hugs and comforting touches. It is in these unimaginable tragic conditions that we are most thankful for everyone on the front line of this crisis. Not only do we count on health workers on the front lines to comfort us when we are sick and scared, but they are there too to offer comforting words, human connection, and healing touches. They reach out when we have to remain apart during illness, prolonged hospital stays, and during heart-wrenching last moments. They keep us informed as our loved ones are being cared for, and they share the saddest of news when illness outcomes can bring only tears. Though little can ease the deep pain of loss, there is comfort in knowing how health workers, from those who support and maintain our hospitals and care homes, to those who deliver direct patient care, have stepped in and stepped up to allow humanity to shine. From the cleaners who share a quiet word of comfort as they go about their duties, or those who bring by the day's meals, to a whole range of healthcare providers to hold a frightened hand and give reassurance. We can know our loved ones are being provided care with human touch and concern in our stead. As you suffer the loss of a loved one, they weep for you and with you. And all Canadians offer sympathy as you suffer the greatest loss of all during this crisis. Today, As I offer these reflections, I'm thanking all Canadians, whether they are helping in our hospitals and long-term care homes, providing essential services, or volunteering in our communities, or continuing to do their very best to stay home to save lives. Because every life matters. So too does our every effort to prevent the spread of COVID-19. Keep it up, Canada. We are stronger together. Thank you.
Thank you, Dr. Tam. We're now going to hear from Dr. New.
Bonjour. Comme d'habitude, je commencerai par faire le point sur le nombre de cas de COVID-19 au Canada. On dénombre actuellement 57 148 cas confirmés de COVID-19, dont 3 606 décès. À ce jour, les laboratoires de partout au pays ont effectué plus de 893 000 analyses et environ 6,5% d'entre elles se sont avérées positives. Habituellement, c'est le moment où nous passons à une brève mise à jour de la manière dont on continue à ralentir l'épidémie et sur ce qu'il faut encore faire ensemble pour aplatir la courbe avec prudence. Mais je voudrais plutôt prendre le temps maintenant de réfléchir à la signification des chiffres quotidiens, des chiffres dont il est impossible de pleinement comprendre le poids. Derrière chacun de ces quelques 57 000 cas se cache une maladie qui a semé la peur et l'inquiétude chez une personne et sa famille, ses amis et sa communauté. Chaque décès a été une tragédie immense. Et plus triste encore de réaliser que ces personnes sont le plus souvent mortes sans avoir pu être réconfortées physiquement par leurs proches sans recevoir de câlins. C'est en pensant à ces situations tragiques, inimaginables, que nous sommes le plus reconnaissants envers tous ceux qui sont en première ligne de cette crise. Non seulement nous pouvons compter sur les travailleurs de la santé en première ligne pour nous réconforter lorsque nous sommes malades et effrayés, mais ils sont aussi là pour nous offrir des mots réconfortants, des contacts humains et des gestes qui guérissent. Ils créent des ponts lorsque nous devons rester séparés pendant la maladie, les séjours prolongés à l'hôpital et lors de ces derniers moments déchirants. Ils nous tiennent informés des soins prodigués à nos proches et partagent les nouvelles les plus tristes lorsque l'évolution de la maladie ne peut apporter que des larmes. Bien que peu de choses puissent soulager,
though little can ease the deep pain of loss, there is comfort in knowing how health workers from those who support and maintain our hospitals and care homes have mobilized to allow humanity to shine. Those who support and maintain our hospitals, staff from care homes, or those who deliver direct patient care. Cleaners who share a quiet word of comfort as they go about their duties, or those who bring by the day's meals, to a whole range of healthcare providers that hold a frightened hand and give reassurance. We can know our loved ones are being provided care with human touch and concern in our stead. As you suffer the loss of a loved one, they weep for you and with you, and all Canadians offer sympathy as you suffer the greatest loss of all during this crisis. Today, as we offer these reflections, I'm thanking all Canadians, whether they are helping in our hospitals and long-term care homes, providing essential services, or volunteering in our communities, or continuing to do their very best to stay home to save lives. Because every life matters, so too does our every effort to prevent the spread of COVID-19. Keep it up, Canada. We are stronger together. Thank you. Thank you. Now we'll be listening to Minister Anand.
Thank you so much, Dr. Tam and Dr. New. I echo your appreciation for our frontline healthcare workers. I, too, will begin by extending my heartfelt condolences to them, to people who have lost loved ones, as well as to the families and friends grieving the loss of the 6 members of the Canadian Armed Forces who lost their lives serving our country. As a fellow Nova Scotian, let me say that we are all grieving with you. Today, I will provide an update on our progress this week.
As in the rest of the world, most of our supplies continue coming from abroad. We are still facing logistical challenges because of the heightened global demand, but significant progress is being made.
Air Canada and Cargojet have helped us bring home 20 plane loads of supplies, with flights coming in nearly every day this past week. We have also engaged UPS to provide additional assistance with moving PPE out of Shanghai. In a competitive environment, our dedicated team on the ground in China ensures that supplies are coming into the warehouse and making their way onto the planes back to Canada.
Our objective is to put safe, reliable, and effective equipment in the hands of our health professionals. And we are taking all necessary measures for this to happen. We are remaining extremely vigilant when it comes to the quality of the products we are distributing.
We make needed adjustments to our supplier base so that we are only dealing with companies that can meet the standards that we require.
Nationally, Canadian companies are continuing to increase production and deliveries are underway.
Medical, based in Toronto, delivered their first shipment of ventilators to the federal government. Our first shipments of face shields began to come in this week, with more than 740,000 received to date, half of which were produced here in Canada by companies like Bauer and Toronto Stamp. I am happy to report that we have also signed new contracts for 15.5 million face shields from Sterling Industries, affiliated with Honda, and from HP Canada. As I mentioned last week, we managed to secure a shipment from China of vital chemical components required to produce reagent. This week, I'm happy to announce that we have finalized a new agreement with Luminultra, a leading biotech company in New Brunswick, as the corporation now has the components that it needs to produce enough reagent for 500,000 more tests per week right through to March of next year. Domestic production right here at home.
I am also delighted to announce that we are now signing a long-term agreement with Medicom in Pointe-Claire in Quebec for the manufacture here in Canada of 20 million N95 respirators and 80 million surgical masks per year for the next 10 years, starting this summer. This long-term procurement source for essential products and for other things is part of our plan to ensure that Canada is prepared now and the future in collaboration with Minister Bains. Furthermore, we have signed a new contract with Logistique Unicor, a manufacturing company in Saint-Jean-sur-Richelieu in Quebec. They are providing 11 million medical gowns. Logistique Unicor is one of the 30,000 corporations which responded to the call for action that was published on the buy and sell site, where we are asking suppliers to help us fight COVID-19.
In how companies across Canada have stepped up to meet the current challenges that we are facing together. Their ingenuity and tenacity will help us through this crisis. Last week, we launched a running report of our procurements on our website, which was updated on Friday. Les chiffres démontrent que nous avons fait des progrès.
The figures are showing that we have made progress in ordering and obtaining supplies from the country and abroad. But we will not slow down our efforts here and abroad. We will not give up. We are not letting up.
Of infections or a sudden resurgence at any given time, which would renew an immediate need for further orders of critical supplies. That is why I have formed a COVID-19 Supply Council, which brings together a diverse group of leaders from the Canadian Chamber of Commerce to the Red Cross to provide advice on building innovative and agile supply chains from start to finish. This council is about bringing together diverse industries and experiences in order to best serve Canadians through the next phases of this crisis. The council complements my work with procurement ministers from provinces and territories right across the country. As an example of our collaboration, when we spoke on Friday, my counterpart in Nunavut raised an urgent shortage of swabs. In concert with the Public Health Agency and the Department of National Defense, we were able to ensure that a shipment of swabs was sent on its way to Nunavut within 24 hours. Cooperation has proven to be invaluable time and time again throughout this crisis. Together, we remain vigilant in our efforts to secure the vital supplies that will keep Canadians safe today, tomorrow, and in the months ahead. Thank you so much. Merci beaucoup.
Thank you, Minister. We're now going to hear from the Minister of Innovation, Science and Industry, Navdeep Bains.
Thank you very much, Anita, and thank you very much, Carl. Nearly 6 weeks ago, we called on Canada's industrial community to help meet a critical need for personal protective equipment and health supplies. We also reached out to the wealth of Canadian research institutions, universities, and scientists to mobilize science in the fight against COVID-19. Since then, two things have stood out for me. First, the speed at which Canadian companies and researchers all across the country have stepped up and offered their help in whatever way they can to assist their fellow Canadians in the crisis. And secondly, the diverse and ingenious ways that Canadian innovation has been deployed to address the challenges we're facing. Neither is surprising to me, and I'm incredibly proud of the work being done by our world-class industrial and scientific community.
More than 6,000 Canadian corporations have offered us their expertise and capacities. We have also mobilized a great number of researchers and scientists who are researching solutions to this unprecedented challenge.
Today, I'm happy to share the most recent progress coming from these efforts. First, I'm pleased to announce a contribution of more than $175 million to AbCellera Biologics. A Vancouver-based biotech company, AbCellera was the first company in North America to receive a sample from a recovered patient. In just a few short weeks, they've screened 6 million cells and have identified over 500 human antibodies. They are now working on identifying which of those 500 antibodies can not only block the COVID-19 virus, but can be made into a drug to treat the virus. AbCellera is currently working with partners to select antibodies that may lead to therapies that are highly potent, broadly neutralizing and capable of large-scale manufacturing. Antibodies found during AbCellera's research may also be used to create tests for COVID-19, and the company is working with several global organizations to support the development of new diagnostics to monitor the disease. Human clinical trials are expected to begin in the summer. Over the long run, the company will create the first facility in Canada capable of producing necessary amounts of antibodies, so our country is prepared to respond to future pandemics. Let me turn now to some updates on test kits and face shields. We know that we will need a large number of reliable and accessible tests if we are to reopen the economy safely and responsibly. That's why we just signed letters of intent with 3 companies. As mentioned by Minister Anand, Luminultra, Custom Biologics, and Diagnostics Canada. These companies were selected through an accelerated process that saw over 100 submissions. Similar to what we did with ventilators, the National Research Council of Canada and a panel of external experts identifies the most promising short-term Canadian manufacturing options for testing.
Engine Supercluster is also supporting other aspects of PPE manufacturing. 8 projects have already been approved.
It has contracted 3 new projects focused on medical face shields. These projects are bringing together manufacturing and 3D printing companies, and the resulting partnerships will result in hundreds of thousands of face shields being produced daily by June 1st.
To conclude, I would like to state that The Scale AI Supercluster is also mobilizing its members and has approved 8 new projects, artificial intelligence to fight against COVID-19.
Innovation is a central part of our mobilization efforts, and by working with Canadian industry and research experts, we continue in our mission of supporting our healthcare workers and ensuring the safety of Canadians as we navigate this pandemic. Together, we will win this fight. Thank you very much. Merci beaucoup.
Thank you, Minister Bains. We are now ready to take questions. As usual, we'll start on the phone with 3 questions, 1 question, 1 follow-up, and then we'll turn to the room. Operateur.
Thank you. Merci. Please press star 1 at this time if you have a question. Puis s'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. La première question est de l'inaudible de la presse canadienne. À vous la parole.
Oui, bonjour. I'm sorry, I think maybe you have some technical issues. I can hardly hear clearly the ministers. So I'm hoping that Dr. Tam, you can answer my question. What happened exactly with the Spartan Cube test? How come it was 3 weeks ago good to go and now it's not?
Yes, so I think it was April the 11th when Health Canada authorized Spartan, the test kit, under an interim order pathway. So this is part of the acceleration of access to innovative testing. But built into that process is actually clinical validation of the device and its system. So it was actually the National Microbiology Laboratory from the Public Health Agency who collaborated with clinical sites in 3 provinces to actually use this device and system to take samples from actual patients. And so while the Spartan system or the device performed very well in a laboratory setting and along the specifications that the manufacturer had provided, it was in the real life setting, in the clinical setting, where it didn't perform well. And right now, it appears that it may be related to the proprietary swab that goes with the system. So I think what Health Canada is doing is to amend the authorized intended use for research use only, so that more clinical validation can be done once the manufacturer adjusts its system. So I actually think this is a really, it really highlights the importance of the kind of quality assurance that we're putting to our new tests, and that really there's been no use of this test kit in a way that would have impacted patient diagnostic outcomes, because you're doing this in the context of an actual clinical trial evaluation.
Okay, I understand. When you talk about the swab, we're talking about the thing that actually gets the sample, I guess. And if not, please correct me. And my question is, on Friday, you were saying that we were testing about 23,000 a day. You were hoping for almost 3 times as much, 60,000. How does this Spartan Cube setback impact this objective?
It actually doesn't impact it, because the provincial territorial target collectively of the 60,000 is just on the existing PCR tests within the public health laboratories. And then we would add on top of that any point of care testing that comes on board, some of which are already in use, such as the Gene Expert. That is, for example, also being used in Nunavut, for example. So some of the points of care is in addition to that initial provincial territorial capacity target of 60,000. And I do know that, the provinces are ramping up the testing, and we'll see what happens in the next 7 days as they ramp up some more. I know that in the last 24 hours, we actually did over 31,000 tests.
Merci, Dr. Tam. Opérateur, prochaine question, s'il vous plaît.
Thank you. Merci. The next question is from Lee Bertone from the Canadian Press. Please go ahead.
Yes, thank you. This question is for Dr. Tam. A number of provinces are going to take the next steps tomorrow, Ontario and Quebec in particular, towards reopening. What will you and other public health officials be watching for, especially in Quebec, where we saw another 1,000 cases reported yesterday? And does the Spartan recall or the issues that have been highlighted there have any impact on what you're seeing in terms of, or what we might expect in terms of long-term reopening up?
Well, I think both of these provinces have plans in place to escalate the testing. And as I've just said, that the target of 60,000 doesn't actually include any additional of those new tests like point of care. But, you know, this is because we're looking at so many different streams of new tests coming on board. They will have to readjust the timelines of perhaps when they would have expected the Spartan system to be on board. But this is the most prudent course of action, because what you don't want is an actual system out there that isn't picking up the cases as it should. So I think that's actually a really good validation approach. In terms of course, as you've heard from chief medical officers of both of those provinces and across the country, there is no exact right pathway down this slope and into the new realities of living with COVID-19. We all know that it has to be cautious, and we have to actually look at what happens. Some of the criteria that we're looking for is actually published, but it involves, of course, looking at cases coming down. So if you see cases coming back up again, you're going to have to reevaluate what's going on. And of course, one of the critical aspects is your healthcare capacity and your ICU capacity. So making sure that they'll be tracking all of those parameters as they go about these sort of baby steps and cautious path towards this new reality of living with COVID-19. So I think everyone will be watching very carefully as to what happens to the activities. And I know that provinces are also trying to separate out the actual clusters within certain settings like long-term care from what might be actually community transmission. So they'll be trying to look at the epidemiology from that perspective as well.
Follow up?
The number of new cases that were reported in Quebec yesterday. Do you think it's appropriate for the province to move ahead on its plans to reopen?
Well, I think this is up to, of course, the province of Quebec to look at their particular situation. And I also know that, of course, Quebec is a very big province, and it may not be the same even within the actual province itself. So I'm absolutely certain Dr. Ruda and the Quebec public health system will be monitoring this all over different aspects of the province. And they may not do things at the same time for different areas of Quebec as well. But the details are within the purview of the province.
Thank you, Dr. Operator. Next question, please.
Thank you. Merci. La prochaine question est de Philippe Vincent Foisier de Radio-Canada.
Philippe Vincent Foisier, Radio-Canada.
Oui, bonjour. J'aimerais savoir, Monsieur New, Madame Tam, est-ce qu'on a assez de tests de dépistage?
Do we have enough screening tests? Because you are talking about a 60,000 target and we are reaching 30,000. Some provinces will be reopening soon, and that is before we are able to carry out enough screenings.
Merci pour la question.
This is Dr. New here. Thank you for your question. It is always a concern for all provinces and territories to have the capacity to screen people within their administrations. The capacity has increased significantly. The provinces and territories are also continuing to increase capacities. As we've said before, there's good capacity throughout the country to take care of diagnostic screening based on the molecular test. Now, we are also introducing other tools like testing at service points. Something is happening now with Spartan, and that's something we need to manage and resolve. But ultimately, we have the capacity, and it's up to the provinces to make adjustments when necessary. And they may also need to loosen up their public service measures. Should I repeat in English? Is that okay?
Okay. What we're saying is, yes, at the present time, certainly the provinces and territories, their capacity for lab testing, which is key, will continue. They've obviously taken steps to increase their lab capacity, and that continues to this day. And certainly within each province and territory, they're making sure that as they maybe start to begin to relax certain public health measures, that capacity to rapidly detect cases is there. Right now, the capacity is based on what we call the molecular tests, and that's something that will continue to be, in a sense, the gold standard for now. But certainly, provinces and territories, as well as the federal government, we're looking at other types of technology to bring more tools available for testing individuals. And we've just talked about what we call point-of-care testing, including the Spartan test, which obviously at this point needs some adjustments, but certainly we hope to, in the coming days and weeks, make the necessary adjustments, at least accompanied, that will allow it to be used in a clinical sense.
Thank you, Dr. Monsieur Foisy. En suivi.
Follow-up question. A clarification. There's something I do not understand. Do we have enough capacity for testing? We are just not doing enough testing? Or don't we have enough? We are doing 30,000 now. The target is 60,000. Maybe I'm not the one who is good in math. Or maybe I'm not the one understanding that enough testing is being done to open the economy, whereas the economy is going to be reopened tomorrow. I will answer, and maybe Dr. Tam will also answer in English. It's difficult because we can't really give you specific figures. It all depends on the demand. If people fall sick, we need to find out if we have diagnostic testing. If somebody falls ill, it's not a matter of just testing everyone. We already know that it's very important to test someone at the right time. If we screen someone who is not ill, there is the danger of having a false negative. So it all depends on demand. What is happening now within the population with the spread of the virus? Well, we have the capacity in the country, but not all provinces and territories. So it's something we need to follow up closely, because if we start relaxing some public health measures, we need a surveillance system and a screening system to properly, rapidly detect the virus. If there is a surge in declared cases, that is really the issue. The issue is not the exact figures or the available tests.
Thank you, Doctor. And I'll turn to the room, starting with Marika Walsh from the Globe and Mail.
Hi, Minister Anand. It's Marika Walsh with the Globe. We're having trouble hearing you, so I'm hoping this will work. I'm just wondering if you can tell me exactly what gap is currently in the supply of PPE that you're hoping this council will fill. What specifically is missing from the complement that this will now help do?
Well, thank you. I hope you can hear me now. Is it any better? The Supply Council isn't meant to fill a particular gap in the supply chain per se, but the goal in establishing the Supply Council is to provide another lens into the point-to-point procurements that we are doing from start to finish, from manufacture to arrival or production in Canada. What is it that we can be doing differently to ensure that we have proper and effective and efficient procurements within our government and across the country? And so the idea is that it is adding to our existing processes by drawing on the expertise of multiple individuals from a diverse set of sectors
so that we can ensure that we are thinking about all the necessary things that we need to be thinking about in procurement. So, for example, in terms of distribution, we have much to learn in terms of diverse communities. Should we be adopting alternative and additional processes to ensure that we can reach vulnerable populations? And part of our conversation with the Supply Council will revolve around Canada's incredible diversity and how we can do better in terms of our procurements to ensure that everyone has the supplies that are necessary across this country.
And what are the government's forecasts of how much PPE we will need, either per number in population or per week or a mix of those, when we reopen? How much more PPE will we need once we are all trying to get back to work?
It's definitely true that across the country, wherever you are, people are talking about personal protective equipment and the incredible needs that we are foreseeing. But let me be clear. Our first priority as the federal government at the current time is to procure PPE for our frontline healthcare workers. That is what we are doing every single day, and we are procuring from international sources. And as Minister Bains and I have been working on very hard, domestic retooling is also part of that equation, diversifying supply chains. In terms of what is going to be needed for PPE, this is an ongoing conversation that I've been having with my provincial and territorial counterparts, and that we are going to be continuing to have as we go through the next phases of the pandemic. But I will say that from a procurement perspective, we are planning for the short and the long term. We are planning for this phase as well as potential additional surges in the pandemic so that we can be prepared for all eventualities. This is procurement like it's never been done before for that very reason. We need to be planning for the short and the long term and all eventualities.
Thank you, Minister. Ashley?
I'm hoping you can tell me what the impact of the Spartan testing setback is on provinces and territories that have ordered this kind of test kits. You said they've talked about trying to ramp up quickly their testing. Well, what impact does this have?
So I think this is in addition to the targeted around 60,000. So we still, even within that scope, got another halfway to go. If you think about, we're doing 30,000 a day, say, since yesterday, there's still room for them to continue to ramp up the testing approaches. And so then the point of care, actually, the key adjustments and plans will be for, I think, the rural and remote communities. So the concept of using these more near patient tests is so that we can render these communities more independent of transportation. So any kind of delays might, in fact, impact on the fact that we need to continue to transport specimens, for example, that would have been dealt with earlier. But we are looking at other supplies of the point of care. So this isn't the only one. So I think it's, again, a dynamic process. There are, suppliers that are a bit more established, if you like. But when we're looking at innovation space, we know that the pathway of innovation will have some bumps. And I think this is one of those bumps. But it only formed one part of the strategy. So I think we will continue to look for other solutions to fill in those gaps. But I think from my perspective, the impact is more on the maybe timeliness of the return on lab testing for the remote.
Okay. And I'm also hoping to get a sense of, how many provinces and territories ordered these Spartan kits and, how many are we talking about? Thousands of millions of kits being held back because of this setback?
We may have to get back to you on the numbers because I don't actually have them. I just know that it was 3 provinces that helped with the clinical trial, which we were involved in. And I think there were 5,500 test kits as a sort of part of that distribution. Beyond that, I don't know that there wouldn't be any distribution, but I don't know how much order there would have been.
I could add something there.
That's great. Thank you.
It would be helpful. I think it is important not to refer to what is happening with the Spartan test kits as a recall. This is part of the process of Spartan ramping up to have tests to be utilized. And we were not expecting that they would be ready at this moment in any case. So in my view, the issues that you're highlighting aren't a recall, aren't defective product at all. The Public Health Lab has said that they will be used in research settings, and Spartan will continue to produce and review and revise the technology that it is producing for the rapid test kits. And then as the testing warrants, they will be able to be used across the country. But again, this is part of the process of producing new technology, of producing something that is going to be very important, but is just getting retooled and ramped up at the current time.
Thank you, Minister. Rachel.
Rachel Haynes from CTV. My first question goes to Dr. Tam. The Prime Minister today, when asked about economies reopening, talked about how there's different realities in each province. But we do know that the virus doesn't know any borders, as we've been told many times, and that would apply here in Canada as well. So as the various provinces reopen at different times, are you going to recommend that interprovincial travel remain completely or become completely shut down to make sure that different pockets don't pop up in different areas?
Well, I think we have to continue to share information about what's going on in each jurisdiction. And the interprovincial approach is done by individual provinces, but we know there has to be coordination amongst them. And so, absolutely, I think every province will be watching, all the other provinces in terms of where their stance is. For provinces that have very minimal healthcare capacity, they're going to be very careful. Some of the territories are still going to be, of course, looking at the 14-day isolation period for anyone coming inside the territory. And I think some of that will necessarily continue until we've seen what actually happens as people gingerly, cautiously go through the next stage. So absolutely, I think people will be watching the other activities, but the issue of what public health systems might do within the provinces, within their jurisdiction, of course, from a federal perspective, is really about maintaining essential services through interprovincial transport in order to maintain the essential supplies that still has to occur. So that will, again, continue as well.
It's Dr. Maybe I'll just add to that is that certainly the provincial authorities and territorial authorities have the best sort of pulse of what's actually happening in their own jurisdictions. They have the data, they know what's happening on the ground. So the issue of travel, et cetera, is not just between provinces, but even within provinces. As we know, even in the province of Quebec, the hotspot is Montreal, and in other parts of the province, the situation might be different. At one point, they even had some restrictions in terms of travel within the province. So I think the principle that they're always looking at, including us at the federal level, is about maintaining physical distancing and whatever measures can be brought to bear to try and reinforce that to the point that it's appropriate and necessary within the provincial context. That's what they'll continue to do.
And as a follow-up, as we're talking about businesses reopening and knowing that there needs to be an adequate amount of PPE and masks and other equipment to make sure that we can stop the spread, as part of today's announcement, will equipment be going directly to businesses or directly to healthcare workers where we know that there are still issues in those types of institutions? Will there be some kind of allocation or breakdown of who is getting this PPE?
Well, I think the healthcare system remains a priority. And so that there is an existing mechanism with the province and territories to look at needs and allocation, and that will continue to be very dynamic. And the framework has been worked out. I think one of the most critical aspects of the next stage is to, as the non-urgent health services come back, is for people to actually look at what those requirements are. And I think also that is done through the provincial system. And also, of course, making sure long-term care, because some of those are private entities, some of them are maybe publicly funded, but that system needs to be able to actually provide the necessary PPE. So those coordination discussions are definitely happening at the ministerial level as well as at the deputy minister's level to make sure that health systems can readjust going forwards. And I think in terms of essential services, there's ongoing discussions, but the key is that any business trying to open must align with public health instructions, and you have to sort of look at the plans for how they reopen and have them looked at by the actual public health authorities. And that's the most important thing, because if you've got the sort of specs, if you like, of the 2 meters or physical barriers or engineering criteria, the businesses know their own businesses or how that works the most. So a lot of them are thinking through exactly how that's going to work in their workplace in order for them to look forwards to planning to reopen. So there's a lot of work, I know that, in that space. And there's a lot of guidance being developed for the different sectors within the jurisdictions as well. And so that's really quite active right now. And we might get a little bit more of an idea of, well, under which circumstances are people not able to maintain the 2 meter distance? And then that will give us a better idea of what that supply requirement might look like.
Thank you, Doctor. I think we have time for one more question on the phone, operator.
Thank you. The next question is from Savannah Odd from Brunswick News. Please go ahead.
Hi there. My question is for Minister Bains. Today we've seen an investment in virtual mental health care and primary care. I'm wondering what's being done to improve reliable internet access for rural Canadians so that they aren't left out of this investment.
Thank you very much for that question. I'm glad you raised this issue. High-speed internet connectivity is no longer a luxury. It's absolutely essential. And our government recognized that we were dealing with this digital divide. We made significant investments in the Connect to Innovate program, which helped 900 communities receive high-speed internet connectivity. We also unveiled in our last budget a universal broadband initiative worth $1.7 billion. And my colleague, Minister Monsef, is responsible for connectivity in that program, and she'll be working very aggressively to move that agenda forward. Because we realized before, but more importantly in this current context, the importance of internet connectivity for families, for work, for people to get essential information, and this continues to remain a priority for our government.
Follow up?
Yes, so, and for Minister Anand, as we see some provinces move faster towards recovery, or I guess in later stages where they're starting to reopen, I guess, before some others, will PPE distribution be affected by that? So if a province is, I guess, further along into a recovery phase, does that factor into how PPE is distributed? I know it currently is per capita with some wiggle room based on emergency, but could you just elaborate on whether that's part of it?
Kim, though, to state that the program that the government is doing is based on requests that have come from the provinces and territories for purchases that they require for frontline healthcare workers. And so, as I said, that is the priority at the current time. In terms of PPE that would be generally available when we move through additional phases of this crisis, again, that is an ongoing discussion, and I've had very positive discussions with the provinces and territories around the procurement table that I have struck with the various ministers from those provinces. But I will say that there is much work to be done on essential services and PPE for essential services. And it's important to remember that the federal government is not the only purchaser of PPE in the country. Hospitals, are procuring PPE, individual businesses are procuring PPE, and healthcare centers themselves are procuring PPE. So this is an ongoing conversation, but it's important to remember that there are a number of purchasers in the country. And the most important point to remember is that the global environment is incredibly strained. The demand is high. And so the federal government is taking a very collaborative and cooperative approach with the provinces and territories in trying to determine the best way forward on these important questions.
Thank you, Minister. Ceci met fin à la conférence de presse pour aujourd'hui. Merci.
This is the end of today's press conference. Thank you.